If we could pull up their presentation, it says Building Bridges, Advancing Public Health Equity and Growing Connections through the Hispanic Outreach Initiative. We have from the Pima County Health Department, Alejandro Perez, Anthony Cisneros, and Tony Ogwin.
¿Listos?
Yeah.
There we go. Let's see here.
And then it looks like your camera might be covered, or I don't know if you have a camera that's on.
No. Let's see here. Oh. Yeah, it's not on.
At least we can see your presentation. It looks like it's...
There we go. There we go. All right. We're online now.
All right.
All righty then. Good afternoon, everyone. Give me 1 second here. Let me rearrange this again. All righty. Hello, everyone. Our speakers for this presentation will be, as you mentioned earlier, Anthony Cisneros, Environmental Health Specialist 2, Alejandro Perez, Environmental Health Technician, and I, myself, Tony Holguin, Admin Assistant 2. We all are a part of the Hispanic Outreach Initiative team. And as you stated, building bridges, advancing public health equity through the CHEFS, which is Consumer Health and Food Safety Hispanic Outreach Initiative program. Next slide, please. Thank you. Our agenda for the presentation is the following. We will be going over the jurisdictional background, objectives of the Hispanic Initiative team, meet the team, coordination of team efforts, showcase work completed and in progress, and then at the end, we'll be taking on the questions. Next slide, please. Background. Next slide, please, again. All righty. So Pima County's racial ethnic background. This information was taken from the 2024 Pima County Health Needs Assessment. If you notice in the green, we have the Hispanic Latino community that makes up the second largest minority racial ethnic group in Pima County. Next slide, please. There you go. Yep. There you go, sir.
Can you see me? Did you mute? Okay. Hello, everyone. My name is Alejandro. I'm one of the environmental health technicians here with the Pima County Health Department. So I'm going to be talking about the education level and primary language breakdown here in Pima County. So according to available data, approximately 27% of Pima County residents speak a language other than English at home. That would make it more than 1 in 4 people. This highlights the rich linguistic diversity present in our community. A key point to consider when we think about public communication, education, and community outreach. Among this 27%, the overwhelming majority, 82.7% speak Spanish at home. This does mean that Spanish is by far the most commonly spoken non-English language in Pima County. This has important implications for how schools, healthcare providers, public agencies, and even local businesses, how they should approach bilingual communication. Spanish language materials, interpretation services, and cultural understanding, they're not just helpful, they are necessary in ensuring equity and inclusion for a significant portion of the population. Shifting gears over to the American Community Survey. So 89.5% of Pima County residents aged 25 and older have obtained at least a high school diploma. That is a strong indicator of the basic educational attainment in the region. It shows that a large portion of the adult population has had access to fundamental education, which is encouraging, but it does not stop there. Of those residents, 35% have a bachelor's degree or higher. This is significant because having a bachelor's degree often opens doors to better job opportunities, higher income potential, and greater civic participation. This also suggests that there is a solid base of skilled professionals in the area, which can attract employers and drive economic development. So when we combine these two factors, language and education, we start to get a clearer picture of the community. Next slide, please. So the objective here, these are the four that we have for you today. So empower Hispanic permit holders to make informed decisions regarding food, aquatic, and vector safety in their facilities. The second one here is to build trust, support ongoing education, and address community needs in Spanish. This is important for us in our ongoing, the next one here is foster strong relationships through meaningful engagement and active collaboration. And finally, share vital health and safety information through culturally relevant outreach. Next slide, please. We'll be sharing what makes up our chef's division, consumer health and food safety, which we have various programs that make up this division. The first would be administrative services. The second one being the non-food area, which includes aquatic safety, general sanitation, and vector surveillance and prevention. And then finally, we have the food program, which includes food safety as well as a plan review. Next slide, please.
Alrighty, good afternoon, everyone. I am Anthony Cisneros, and I'm going to be going over Meet the Team, Meet the Hispanic Initiative Outreach Team. This was established in August of 2024, and we have 10 bilingual consumer health and food safety subject matter experts. We have our program manager, Cecia. We have one environmental health supervisor, Rocio. We have administrative service manager, Melissa. And we have our admin staff. You've already met them before, Tony and Nicole. Two plan reviewers, we have Ana, who presented yesterday, and Grecia. I am the lone training officer on the Hispanic Outreach Initiative team. And we have two technicians, Alejandro, who just spoke, and Martin. Multilingual compensation county policy. So employees may be eligible to earn up to an additional $1 per hour based on their proficiency in the second language and how frequently they use it in the workplace. So we do partner with a third party to give out that proficiency test to make sure to base whether we get $1, whether we get 50 cents, kind of determining our proficiency in that second language, which would be Spanish. Consumer health and food safety criteria. We do have to pass our probationary period, and additional staff eligibility is based on departmental need and evaluated case by case. So there are some Spanish speakers on our staff that do speak Spanish, but they don't yet meet the consumer health and food safety criteria to be on the team. Whether that be they need to pass a probationary period or whether we just don't need the help yet. That's the criteria that they need to meet. The multilingual compensation county policy, that is county-wide. However, the Hispanic Initiative Outreach Team, that is something that is strictly created by us at Consumer Health and Food Safety here at Pima County. Yeah, it's kind of funny. Thank you, Tim, for taking this photo of us. He is still with us. Martin right here. He looks like a ghost, but he is alive and well, just so everyone is aware. Monthly work time allocation. So every third Thursday of the month, we have a dedicated 4-hour work block, and that's to plan outreach events, work on translation projects, idea generation, and a big part of the third Thursday meeting that we have is practicing live translations. So yes, some of us do, presentations are part of our daily work duties, but it's a little bit different practicing and kind of translating while you're giving a presentation. So it's one thing to present in English. It's a totally different beast, totally different thing, having to do a project, do a presentation in a different language. Even if you speak it, even if it's native to you, there are some, words that you've never spoken before. There are words that you don't really use all that often that you do have to use when you're giving out these presentations. And yeah, it's not that this was, we started this in August 2024 and we had this all planned out. No, this dedicated 4-hour block is something that took a little bit of time to get into place. All of our managers, our supervisors came together, big meeting, and just kind of bounced ideas off of each other on what would be best for how to go about getting work done for the Hispanic Outreach Initiative team. And we do understand, everyone understands that primary work duties come first. If there's ever a time where one of us cannot attend this meeting, we reach out to our supervisors and say, hey, I'll need to make up my 4-hour time block some other time. I'll need to have some time to do that throughout the month. So yeah, very flexible, but yeah, we do try to meet at least once a month, every third Thursday of the month for 4 hours to try to work on things that we can do to help our Spanish speaking community. We do use Microsoft Teams for our central hub for coordination. In our Microsoft Teams channel, we have notes from our meetings. We have all the meetings that we've had already with organizations. We have recorded presentations. We have the PowerPoint presentations. We have attendance sheets, everything, you name it, that's in there in the Microsoft Teams channel, in our all staff Teams channel. We also have some projects, all the projects that we've been working on so far, completed and in progress. Anyone who is on the Hispanic outreach team and any of these supervisors or managers is able to view this, all this information, all of this, all the items that we have here stored in our Hispanic Outreach Initiative Teams channel. And I will pass it off to Tony.
There we go. All righty. Here we go again. Administration Services Program. Next slide, please. Let's introduce the team. Our administrative assistant team is headed by Ms. Lonnie Anderson, our division manager, Ms. Melissa Duran, our admin manager, Ms. Candace Abrams, and Renee Mercer, supervisors, and then our wonderful admin team who I'm fortunate to be part of. We have Neosha, we have Nicole, myself, and Teresa. We also have 2 vacant positions waiting to be filled soon. We're currently not running at full capacity. Success is chefs. Consumer health and food safety starts with the admin team, providing reliable information, as this is the foundation for that. Next slide, please. Thank you. Administrative service program supporting the Hispanic community. Here are some of the services, tasks that the administrative assistants do. Bilingual customer service. We address questions in both English and Spanish, in person, email, and by phone. Assist Spanish-speaking community members with understanding permit requirements. Provide cultural sensitive guidance to ensure clear communication. Permit application assistance. Help complete applications for annual permits, which consist of 90% of chefs' consumer health and food safety revenue. Let that sink in, 95%, big number. Temporary and seasonal event permits, guide applicants to the correct forms and procedures, language accessibility, and trust building, bridging the language gap for limited or non-English speakers, build stronger rapport with the Hispanic community, ensure clearer understanding, excuse me, of procedures, and encourage repeat engagement and confidence in county services. Here are a few frequently asked questions, that we get a lot at the window. So what do I need to do to open up a food truck? What does it cost? How fast is the application process? We get these questions quite a bit. Is that all you need? So now that we have that information that's being requested, we can better direct and provide guidance in what is needed to give them an answer and a better understanding of what needs to be done first. This creates rapport and a better connection with the community. The Hispanic community reaches out to us and they share what they need. We assist, we guide, we provide, creating trust and repeat continuous communication. Next slide, please. Complaints. We actually also take complaints in Spanish, whether if it's walk-in or by phone, online. If the online form is chosen, you may switch the language to Spanish so that it allows a constituent to enter the complaint, the information that we need in Spanish, which creates easier direction, and it assists us as well in getting that information, and obviously in Spanish. Next slide, please. There we go. Administrative Service Program, largest Hispanic representation in Pima County. Many Spanish-speaking residents, they own or operate, food trucks, mobile food trucks. Some even have multiple. They participate in temporary seasonal event booths, community events involving mobile food vendors. Recently, we had Tucson host the Mexican baseball fiesta at the Kino Sports Complex. This was an introduction to showcase some of the baseball teams that are participating in Tucson from Mexico, which was great. Many temporary food booth participants. And now this is going to be a season. So Liga Arco, baseball season, hopefully soon to be home of the Tucson baseball team, will be hosting the teams coming from Mexico and playing at the Kino Sports Complex for the season. Recent Spanish language outreach. Now, it's hosted and it's a hybrid, mobile food forum entirely in Spanish. The attendees were there in person or virtually, excuse me. This is specifically designed for Spanish-speaking mobile food vendors. It offers compliance help and an opportunity to ask questions in the preferred language. If there are any type of concerns regarding confusion around the permitting process, our team is here to assist by providing guidance, clarifying requirements, and connecting constituents with the appropriate departments. We support new businesses by helping to ease uncertainty around documentation and permitting, and ultimately making the process more approachable and obviously encouraging entrepreneurship. Thank you very much.
All right. So I'll be going over our non-food program. As I mentioned, this is the General Sanitation, Aquatic Safety, and Vector Surveillance and Prevention Program. Next slide, please. So program overview, we address vector-related concerns and conduct routine pool safety, sanitation, and prevention to reduce waterborne and vector-borne illnesses. So we conduct our usual annual pool inspections. We also do inspections on mobile home parks. We check under units where vector carriers can possibly harbor and spread. We also do schools where we inspect overall hygiene of our schools in Pima County. And then we also inspect hotels or lodging facilities. We also check for hygiene in their rooms, in their common areas. Um, we also do vector trapping, so mosquitoes. We routinely monitor transmitters by trapping and testing for potential diseases in numerous areas throughout Pima County. And then finally, we also host and engage in community outreach activities. Next slide, please. So as always, we're trying to make our program better, expand at all times. We try to expand beyond permit holders and try to educate the general public. In these two examples here, you see photos. This is actually part of the Hispanic outreach initiative. Something we did this year was meet with organizations such as Chicanos por la Causa, which we met with, I believe, 3 times this year. We met with their Hispanic elderly population. We provided education on drowning prevention, how to better deal with heat stress and heat related illnesses throughout the summer. Next slide, please. So pool safety, pre-recorded presentations. So here are 2 examples of 2 pre-recorded presentations available to the public on YouTube in English and Spanish. This year, this is some of the projects that we have been working on as part of the Hispanic Outreach Initiative. Thanks to a recent aquatic grant, we've been able to focus on these projects. This includes translating our pool class to start presenting it to our Spanish-speaking community, as well as drowning prevention efforts. Next slide, please. Some of the content that we've translated recently, along with our comms team, so huge thank you to them. Something we also hold monthly is our pool classes. This is for operators and technicians looking to get certified through us. This is a class that we hold so they can know what to expect when we arrive at their facilities and do our inspections. We also provide free swimming classes, swimming lessons in partnership with the YMCA. And then lastly, we also provided the ABCDs of preventing drowning. This is focused more for our low income Hispanic communities. They're definitely the most benefited from these swimming lessons. Next slide, please.
Alrighty, thank you, Alejandro. So yeah, I'm gonna be presenting, this is Anthony. I'm gonna be presenting on our food safety program. And I kind of want to take you guys back in time to when I first got hired with the Pima County Health Department in May of 2022. Once I finished through regular field training, I was placed on what we have called Team Mobile. Team Mobile, they handle a lot of temporary events, seasonal events, and a lot of mobile food units, operating mobile food units. And a big part of being on Team Mobile is having to deal with and work with operators who primarily speak Spanish or only speak Spanish or prefer to speak in Spanish. So it was there, being on Team Mobile, that I noticed the need for this type of team. As you know, a lot of people, majority of the people who operate at temporary events, and for mobile food units, they prefer to speak Spanish. They primarily only speak Spanish. So yeah, that's where I figured and I realized that this team was a big need for us in providing equitable education information, you know, for everyone across Pima County. And we saw from, you know, the first couple slides, it's the second most populous race, ethnicity group here in Pima County. So that's all about being equitable. So yeah, we'll get into it. Our food safety program. So yeah, like I said, our initial focus is on temporary seasonal events and mobile food units to meet the high demand within the Hispanic community. So we do this by hosting, engaging in community outreach forums, partnering with other community groups and organizations that kind of focus and help our Spanish speaking and our Spanish community. Spanish translations available for non-Spanish speaking environmental health staff. So our outreach team can assist field staff by phone or accompany non-Spanish speaking environmental health staff during inspections. So yeah, and if it's ever the case that, every one of the Hispanic Outreach Initiative team members are tied up, they can't, break away from their regular work duties. Our non-Spanish speaking EHS staff can also call what we have, I believe it's Line Languages Services. That's our third party that we use for our translation lines. So if we ever encounter, whether it be Spanish, whether it be, Mandarin, any other language that isn't English, we're able to contact our Line Language Services, and they're able to help us throughout the inspection and translate for us. So that just goes to show it's not just Spanish. We are able to do and translate and communicate with any language here in Pima County. And also the translation of educational material. So we do want to promote inclusion and equity for all permit holders in Pima County with culturally and linguistically tailored support for native Spanish speakers. So that means basically we're not just taking all of our documents, throwing them into Google Translate and, taking what Google Translate gives us, putting it back into a document. A lot of the time you'll notice if you do have a language that you speak other than English, it will give you some pretty crazy, translations, and sometimes it's not right. Sometimes it's good. Sometimes it's not right. So we want to make sure that the information that we're providing, the information that we are providing to our Spanish speaking operators and our people that we work with on a daily basis, it is culturally and linguistically tailored for them so that they are able to understand and kind of take with them the information that we are giving them during inspection, during a community forum. Anytime that we can provide education, we want them to understand it, digest it, and take it with them when they're operating or throughout their daily life. And as Alejandro was talking about earlier in the presentation, a majority of the residents in Pima County, really the highest degree of education that they have, the highest education level that they have is high school diploma. So just, being understanding of that and trying to meet them where they're at. We're not expecting them to understand highly technical vocabulary. The information that we're trying to put out is tailored to them so that they're able to understand and, take it and run with it. Let's see, next slide. Have a couple of photos from some of our community forums and some of our presentations. So far we've had about 15 community outreach forums. We've partnered with organizations such as the YWCA, Tesoro Business, Pima Animal Care Clinic, Chicanos por la Causa, as Alejandro stated, and the city of Tucson as well. We've done a couple different formats. One where for our presentations, one being we have one slide in English and then the following slide is in Spanish. And we've also done another format where we have a English session in the morning and a Spanish session in the afternoon, or just at different times. And we've noted and we've noticed that both of these formats, they both have their advantages and they both work well. So it really depends on the mix of the racial and ethnic group that you have attending your forum or your presentation. It really just depends. We've gotten feedback that people have liked, an English slide first and a Spanish slide first. We've also gotten feedback that people like one English session and one Spanish session. We also do in-person presentations, forums. We also do virtual sessions. If people are not able to attend in person, they are always able to join online via Microsoft Teams. And these presentations, as you can see on the bottom left, they are recorded and they are uploaded into YouTube. So anytime someone needs that information, they're able to go onto our YouTube page and look it up and watch it at a later time if they're not able to view it. Just showing you some of the pictures here. Top left, that is myself and Melissa Duran. We went to the NACHO conference in Anaheim this past July. Might have been June. It was in the summer. And we presented on, we had a poster presentation for this outreach initiative team. Right there in the middle, we have Brenda Catterman. She's our mobile team supervisor. We have Cecilia Estrada, our program manager, and Nicole Barnett, one of our admin staff. They are there. I believe that is at Tesoro Business, and they are presenting on mobile food units. And also on the top right, we also have Brenda. That's also Brenda. We have Dan, our plan review team supervisor, and also Martin Perez. They are also presenting on mobile food units. Bottom left, that is a virtual presentation that we gave for seasonal and temporary events here in Pima County, just the regulations, everything that we are looking for when we're doing these inspections, application process, things like that. And bottom middle, that's Rocio and I, and also on the bottom right, sorry, I don't know my directions. Bottom right, we have, that was at Chicanos por la Causa. Me and Rocio did a tabling event. The sun was beating down on us. We were not happy we got sent out to that, but we were happy to, be there for the community, be there for, to provide that education. It just sucked that we were in the sun. We didn't have an umbrella. And then on the bottom, yeah, that's also at Chicanos por la Causa. I gave a presentation to the elderly population on the 5 foodborne illness risk factors. Yep. And then here are some of the translation projects and the presentations that we've been working on so far, the ones that are completed. So yeah, we partnered with the city of Tucson for a community forum on the cottage food program. That's the one in the middle. Mobile food units, the one on the right, and fixed facility restaurants, one on the bottom left. We've also translated our plan review documents. On the top left, you'll see that is our plan review application that has been translated completely from English to Spanish. And also in the middle, you have our plan review guide to submitting plan review for a mobile food unit. The top right, you'll see the food handlers exam that has been translated from English to Spanish for the test takers that we have that come in that really only speak Spanish, that understand better in Spanish. So we do want to provide that for them so that they're able to take the test in the language that they know, that they're comfortable with, and that if they have any questions, they can come up to the window and see Tony and see Nicole, or come up to any of the people on the Hispanic Initiative team, and we're able to help them out. That NIHA signal is there, insignia is there, because we got the opportunity, us as Consumer Health and Food Safety, we got the opportunity to translate one of the guidance documents that NIHA uses for Spanish-speaking operators. So that was a great opportunity. We are very thankful that we got to do that and help NIHA with that. So that was a great experience, and we are excited. Going to the next slide. Measuring success. So, sorry. So building and strengthening relationships proactively. I know Alejandro talked about it before, but we noticed that during COVID, the COVID-19 pandemic, we lost a lot of the relationships that we had built, and even the ones that weren't that strong, we lost them completely. So we figured that before the next COVID-19, before the next disaster, we want to be prepared and we want to establish these connections. before the next emergency to foster stronger collaboration and trust. We want to be prepared for when the next big thing happens, not to kind of scrambling after to figure out, how can we get out there? How can we make an impact? How can we do better for our population? Track outreach impact over time. So we do use SharePoint tracking to measure against future events, presentations from last month versus presentations from the months over. We monitor key engagement metrics such as event attendance year over year, overall participation levels, and sustained relationships with community organizations. So we measure our success by, the city of Tucson continuing to reach out, Chicanos por la Causa continuing to reach out and saying, hey, we like what you guys are doing. Our attendees, our community, they like what you're doing. They think it's, valuable information. They aren't bored when you guys come over and talk to us. That's another way that we measure our success. Are the community organizations that we partner with, are they always wanting to come back? Are they continuing to say, yes, this is a great opportunity for both Pima County Health Department and the community organization to educate people and empower people and make people have informed decisions on their business, on their health, and what they want to do. Improve compliance with regulatory requirements. So using risk factor study findings to measure reductions in non-compliance issues and fewer rescinded plan review inspections. We are starting this now. We don't have the results yet, but we are looking to, over a long period of time, see if there are any risk factor violations that have been reduced, that were noticed as non-compliant during inspections, that have been, not noted during inspections. For these Spanish-speaking facilities, are they taking what we're providing? Are they taking the information that we're providing and using it? Is this really working for these facilities that prefer to speak in Spanish, that only speak in Spanish? Is this working for them? Are we doing everything that we need to be doing so that they are given every opportunity to understand and implement what we are trying to accomplish here at the Hispanic Outreach Initiative? And also fewer rescinded plan review inspections. In one of my earlier slides, I did note that, or it was written down that a high majority of the mobile food unit operators are Spanish speaking only, or prefer to speak in Spanish. So that's another reason why the plan review application was translated from English to Spanish. We've noticed such a high intake of Spanish speaking only operators. So just moving with that, taking what we are observing during our time here at Pima County Health Department and focusing on trying to have fewer rescinded plan review inspections and increase team efficiency long-term. So minimizing staff time spent redirecting constituents and permit holders by improving their familiarity with our processes. So that just doesn't mean throughout inspections. That means, when people come up to the window and ask Tony and Nicole questions, are they, questions that have already been asked? Are they common questions that are asked? Do these people who are coming to the window, are they asking about, permitting, the reasons for permitting, the ways to go about getting a permit? How do I build my business? How do I start my business? So it kind of helps our admin team and it helps our inspection team when they're out on the field. Are we lessening the time needed to provide and give enforcement action because our team is working on providing that education for our Spanish-speaking permit holders and our operators, and also invest now for long-term impact. So yes, we do understand 4-hour blocks, that is a lot to set aside for this type of work. But while this approach may require an initial investment, it promotes a proactive and equitable strategy, shifting from reactive enforcement-heavy actions to education-first engagement. So we are trying to get ahead of the curve. We are not trying to have, restaurants, aquatic facilities shut down because they don't have certain things, because equipment isn't working, because they're not cooling right. We want to provide everyone with the information that they need beforehand, so it's not a disaster when we walk in for a routine inspection. So we're not having to, perhaps close so many facilities because they're not sure what to do. They're not sure the best way to cool foods. They don't know about proper cooling methods. They need more information on, maintenance of their refrigeration equipment. So yeah, it's all about getting ahead of the curve and investing our time now for a long-term impact for 2 years in the future, 5 years in the future. This is something that we're using to measure our success. And then sustaining impact, long-term vision. So continue to expand tools for compliance and safety and bilingual educational resources. That also means building on the work that we have already done. So all of our completed stuff, nothing in our folders is ever finished. There's always something that we can include. There's always something that we can add to make it easier for people to understand. Yeah, so we're never done. We're always working on things. We're always tweaking stuff. It's never over here for us. We're always looking to improve on what is already completed and also what we're noticing out in the field. If we have our meeting, we have a 4-hour dedicated block, and we're all noticing the same problems. Or, hey, I'm noticing we're having a problem with our primarily Spanish-speaking permit holders. They're having a problem with this. Should we focus more towards on this or have a community forum on this? So yeah, and then also maintaining a strategic and efficient approach to conducting community-based outreach. Like I said earlier, we give out surveys after our community forums, and we're always looking for ways to improve. Can this be better? Do you as an attendee, do you have any suggestions for us so that we can better this presentation for you, so that we can tailor this information to you in a better and more easily digestible way? Is there anything that confused you? Is there anything that you wanted us to talk about more? Just always looking to maintain a strategic and efficient approach to conducting community-based outreach. And I believe that's it. Does anyone have any questions? I haven't checked Slido.
Yeah, it looks like we have 2 questions and a lot of positive comments. So we'll go ahead and start with the first one. Can you speak on the importance of including historically marginalized communities into our public health systems?
I'm sorry, can you repeat that?
Of course, yeah. Can you speak on the importance of including historically marginalized communities into our public health systems?
No, it's important because we want to provide equitable information for everyone. Equitable information for everyone, and we want to make sure that everyone understands compliance, what we're looking for, what we are trying to do and trying to get out of our inspections, and also to reduce our risk factor violations that are noticed throughout the inspections, And we're also trying to be more user-focused with our processes. We understand what's going on. We know because we're making and we are enforcing these codes and rules and regulations. But do our marginalized communities understand what's going on? Do they know what's expected of them when we show up for an inspection, for a pool inspection, mobile home park inspection, fixed facility inspection, anything like that. So throughout our inspections, we are trying to be more user focused, focus on our risk factor violations, and also reduce foodborne illnesses. Our primary focus really is our risk factor violations during our inspections. So making sure that throughout our inspections, we try to help reduce illness, reduce all the risk factors that go into a foodborne illness outbreak.
Gotcha. Thank you. Our next question: where do you want to see the program go? What ideas are you going to expand on?
It's a great question. We want this outreach team to be on the news. No, I'm just kidding. We want to include more languages, hopefully. That's something that it's right now our only focus is, well, we only have a Hispanic outreach initiative team because that's where we've noticed the most need for this type of team. But hopefully in the future, we can, get more inspectors or get a little bit different, not different, but get more inspectors that understand different languages so that we can, provide that information for, not just English speakers and Spanish speakers, but to everyone that's throughout our Pima County. We are a very diverse community, so we hope to meet people where they're at and, not have, just like Spanish, not have people, try to understand what's going on, but to be able to talk to inspectors, talk to someone, a subject matter expert in a language that they prefer to speak in, and also evolve with the community's needs. That's something that we want to focus on in the future. So yeah, wherever the community takes us, that's where we want to go.
Great. Thank you so much. All right, the next question. Are the Pima County's bilingual and educational informational tools available to the community on the public website?
Yes. Yeah, it's available on our, what is it? Intranet, I believe. Internet, sorry. It's just, yeah, you can, just type in Pima County and you'll go to our webpage, Consumer Health and Food Safety, and all of our handouts there are in Spanish and English. And we also have a form to request any form that we do have in any of the languages, whether that be, Mandarin, whether that be any other language. It's escaping me all the languages that are spoken throughout the world right now. But if anyone has any, specific language that they want a form in or a handout in, we are able to provide that for them.
That's great. Let me just go through some of these. All right, well, that is it. Otherwise, you have a bunch of positive comments. I'll go ahead and put the positive ones in the chat. And thank you so much for your time. Did you want to expand on anything with us?
I don't believe so. What are the comments saying?
You don't believe so? Okay.
I don't think so. I think we're good.
Awesome.
Yeah, I think we're good. Do you need us to talk more? Because I know we have 10 minutes.
You do have 10 minutes. But I'll go ahead and let's see here. Let's see what the team says. All yeah, you guys are all set. Thank you so much for your time.
Alrighty, no, thank you. We appreciate the opportunity.
Of course. I hope you have a great day.
You too.
And I'll hand it off to you, Jake.